Yes, we discussed all the issues already. So going back to the first multiple choice question, which was the treatment for the patient on the first diagnosis of lifestyle limiting claudication. So I think that we all agree that exercise treatment, exercise training should be the first choice, possibly supervised exercise. And of course, if you do revascularization, do a trial at least of exercise training before, but do not forget at least advising walking in these patients. And I mean, you can go for endovascular revascularization, but it is not really the recommendation that we should give to our patients. The second was the anti-thrombotic therapy for claudication. So we already covered this point, and clopidogrel is the first option. And we will see probably in the future updates of the guidelines, there will be room for the COMPASS trial results. And also aspirin in clinical practice is still being used, maybe even too much as compared to the available evidence, as Francesco insists on. And then we had a multiple choice question after failure of conservative therapy. So, of course, revascularization is appropriate if the patient is still complaining from lifestyles limiting symptoms and possibly associated with exercise training whenever feasible. And finally, yes, the anti-thrombotic therapy following angioplasty. In this case, first was angioplasty, plain balloon angioplasty without stent implantations. So we recommend in general dual for 1 month. You can do longer if you want, and again, we will wait for the results of the Voyager trial to see if rivaroxaban is specifically useful in these patients. And following stent implantation, again, the first choice should be at least 1 month, we say in the guidelines. I think that most people use for at least 3 months if the patient doesn't bleed, of course, if he has no contraindications, because the length of disease is really really much different from the coronary artery disease. So there is a lot of activation of the coagulation going on. And again, rivaroxaban will show probably more results from the Voyager trial. That's it.